Hey guys, so again with the Adult Health 1, Exam 2, I'm going to continue on to Chapter 26, which is Management of Patients with Dysrhythmias and Cardiac or Conduction Problems. Words you should know: ablation, anti-arrhythmic medications, defibrillation, dysrhythmias, P-wave, QRS complex, T-wave, and sinus rhythm. So let me pull out my Quizlet, continue on with those terms. Alright, ablation is a partial destruction of the pathway of the electrical conduction system of the heart to treat irregular heart rhythms. So you're causing damage in order to treat a problem for ablation. Hi, Bella. Alright, anti-arrhythmic medications. Obviously, you know they're to treat arrhythmias, but I put some main ones that you're going to see. Procainamide, amiodarone, lidocaine, and sotalol. Also, you'll see calcium channel blockers such as verapamil and diltiazem. Alright, defibrillation. This is the use of electrical shock to restore the heart's normal rhythm. Dysrhythmias is an abnormality in the physiological rhythm, especially in the activity of the brain or the heart, obviously the heart in this case. The P-wave represents atrial depolarization. The QRS complex represents ventricular depolarization. The T-wave represents ventricular repolarization. And your sinus rhythm is the normal beating of the heart. All right, so let's move on. All right, dysrhythmias. Again, these are disorders of the formation or conduction or both of the electrical impulse within the heart. Their treatments are based on the frequency and severity of the symptoms produced, and they are named according to the size of origin of the impulse and the mechanism of formation or conduction involved. Normal electrical conduction. It normally occurs at the rate of 60 to 100 times per minute. Again, your heart rate. Electrical impulse quickly travels from the SA node through the atria to the atrioventricular node, known as conduction. Depolarization is electrical stimulation, and repolarization is electrical contraction. It's got a nice picture of an ECG here. The P-wave represents the electrical impulse starting in the SA node and spreading through the atria and represents, again, atrial depolarization. The QRS complex represents ventricular depolarization, and the T-wave represents ventricular repolarization. And the PR interval, this is the beginning of the P-wave to the beginning of the QRS complex, and it ranges from 0.12 to 0.20 seconds in duration. It's got a nice picture of normal sinus rhythm, bradycardia, so slow heart rate, tachycardia, which is going to be a fast heart rate, and then atrial fibrillation when it's not all over the place, but you can definitely tell it's not normal. So take a look at those. Oh, and then atrial flutter. But she didn't say we had to know any of that. So, cardioversion and defibrillation. These are going to be used to treat tachydysrhythmia, so fast heart rate dysrhythmia, delivering an electrical current that depolarizes a critical mass of myocardial cells, and it's used in emergency situations as the treatment of choice for ventricular fibrillation and pulseless VT or VTAC. Ventricular tachycardia. Got a nice picture. Pacemaker therapy. This is an electronic device that provides electrical stimuli to the heart muscle. It is used when a patient has a permanent or temporary slower than normal impulse formation. It is used to control some tachydysrhythmias that do not respond to medications, and a pacemaker can be permanent or temporary. Temporary pacemakers are used to support patients until they improve or receive a permanent pacemaker. It's got a picture of a pacemaker, temporary pacemaker, pacemaker rhythm, which is definitely going to be different. That's very interesting. All right, implantable cardioverter defibrillator. It's an electronic device that detects and terminates life-threatening episodes of tachycardia or fibrillation. And it's important to educate the patient on it. And that is it for Chapter 26, Management of Patients with Dysrhythmias and Cardiac Problems. And I will continue with Chapter 27 in the next video.